Up next is Bethany Christie. Bethany is in her second year of the Master's in Applied Behavior Analysis program. She is planning to graduate this semester and pop out a baby at the same time. So she's going to be talking to you today about her thesis research, which is on the teach-back method. You'll see that although our psychology students might have some psychopathic tendencies, they learn really quickly. So she's going to tell you about her thesis.
Hey, I'm Bethany. As Dr. Bayles said, I am in my last semester in the Master's in Applied Behavior Analysis program, or the ABA program. So this is a pre-professional program that trains individuals to become Board Certified Behavior Analysts, or BCBAs. So BCBAs do a wide range of things, but the predominant focus in the field is working with individuals with intellectual and developmental disabilities. So there's a lot of things that we do with these individuals, but the main focus is treating them for different problem behaviors. These problem behaviors can come in a wide range of things, but the most we see in the clinic is things like self-injury, aggression, property destructions, and things like that. So a functional analysis is a very big part of the field. This is a small experiment that BCBAs do within the clinic, and this allows them to understand what environmental variables are maintaining a problem behavior. And from there, they are able to create functional treatment plans that best treat the problem behavior at its source. So although functional analysis is very important for the field, it is sometimes not used so much in the clinic because it involves them to need another person, which is a registered behavior technician or an RBT, to help them. And these RBTs do not come trained, so the BCBA has to take time out of their already busy day to train the RBTs, and this can be a tedious task. So behavior skills training, or BST, is an empirically validated method to train functional analysis, and this involves the person reading instructions. After that, they watch the teacher model it for them, and then they do it themselves and receive constructive feedback until they meet the mastery criteria. Although this is empirically validated and we know it works, it is time consuming. It takes a lot of preparation work and it involves a lot of materials. So this also is not best for BCBAs to be doing in the clinic because they just don't have the time to do this in the clinic. So the teach-back method, however, is another form of teaching. It is seen a lot in healthcare facilities. So this involves you teaching someone something and they teach it right back to you in their own words. So this can just test for understanding to make sure they actually understand what you're saying. Although we see it a lot in healthcare facilities, we rarely see it in the behavior setting. And there has been absolutely no research to see if this method works for teaching functional analysis. Therefore, the purpose of this study was to test the teach-back method and written instructions to see if it would work to teach functional analysis conditions for the 3 conditions that we tested, which was play, attention, and escape. So before I go into my methods, I'm going to explain those 3 conditions so there's a little bit more understanding. So the attention condition of a functional analysis is to see if the problem behavior is maintained by attention. So if my client was engaging in self-injury, the attention condition would be if they engaged in self-injury, I would say something like, don't hurt yourself, or I don't want you to hurt yourself, like please don't do that. And the escape condition is to see if the client is doing it to escape from task demands. So these task demands can be academic demands or life skills like go brush your teeth or anything like that. So it's seeing if the problem behavior, if they're doing it to escape something. And the play condition is a control for all the other conditions. So they have all the toys they want, they have all the attention they want, and they have no demands at all. So they're just having a good time in this condition. So for my participants, I had 7 participants. They were aged between 20 and 30 years old. 4 of them were undergraduates at JSU. 2 of them were graduate students at JSU, which were also registered behavior technicians, or RBTs. And then one of my participants was a RBT that was not a student at all, and she worked in a local clinic in Lincoln. So my research was done in Ayers Hall in a research room, and then some of it was done in the practicum site in Lincoln, Alabama. So for the response measurements, the dependent variable that I was looking at was the percentage of correct steps that they were doing for the functional analysis. The independent variable was the teach-back method. And so for the participants, I was seeing what steps they were doing correctly for how they were responding to the Confederate client's behavior. And then the experimenter, or I was scored on if I was asking the teach-back questions correctly. So all of the sessions were also recorded to make sure that the data were taken correctly so we could go back and look at the data. So inter-observer agreement was also taken during this time, and it was maintained at 100 or at 98%, and procedural integrity was at 100%. And data were taken by 2 graduate students in ABA, and a 3rd observer was also a professor. So for the baseline, the participants received written instructions. So this was testing to see what the written instructions did. It was just written instructions. So they got instructions for all 3 conditions, and then after they read the instructions, they were asked to perform it to the best of their abilities just based off what they read. And then if they did not master it off of the written instructions, they went to the teach back. So this involved them reading the same instructions, and then I asked them a set of questions based off of the instructions to test if they understood what they were reading. And I told them if they were correct or incorrect and told them why, and we continued asking them the questions until they were able to answer every single question correctly. And then after that, they were asked to perform a functional analysis again to see if these skills, if this helped them. So for the results up here, I have on the y-axis percentage of correct responses, and on the x-axis we have sessions. So I know y'all probably can't see, but the triangle denotes responding in the escape condition, the square denotes responding in the attention condition, and the circle denotes responding in the play condition. So up here we have participant 6. She's all by herself because she was a little bit different. So she responded highly very quickly already for the very first try, and she was able to master out the whole functional analysis without even having to go into the teach back. So she did it just based off reading her instructions, and she did it good. So that's why she's up there. The rest of my participants are at the bottom. On the left-hand column, we have participant 1, 2, and 4. So they were all able to master at least one of the conditions with just the written instructions, but then they also had to go into teach back for 1 or 2 of them, and they were able to master whatever condition they had to go into teach back for after 1 session. And then the people in the right-hand column, participants 5, 7, and 3, they did not master anything in baseline, which was the written instructions only, but whenever they went to teach back, they were able to master the functional analysis conditions with just 1 or 2 sessions. So the functional analysis was able to be taught to all of my participants in 12 sessions or less, and we also used very minimal materials. 4 participants mastered at least 1 condition during written instructions alone, which might show that functional analysis might be a little bit easier to teach than we once thought. And participants were also successful at conducting all of the conditions after the teach back procedure. And I also want to say that the teach back procedure, the mean time that it took was only 2 minutes and 30 seconds, which is very quick. So it was a very quick procedure. So this shows that the teach back method is probably very good for teaching functional analysis. So there were a few limitations of the study. The implementation of the functional analysis was not done on actual clients. It was with a Confederate client. I was the Confederate client, so it might be a little different with actual clients. Also, the participants had access to the instructions while the condition was being ran, so this also led to them reading the instructions while they were doing the condition. So future research could examine the generalization and maintenance of the skills acquired during teach back in the real world settings. It could also investigate teach back for teaching different and complex skills in behavior analysis. This would just see if it's a good technique to use for all skills, not just functional analysis. Future research could also explore the effectiveness of teach back for teaching diverse learners, including people with different levels of behavior skills. So maybe my participants were just really smart, is basically what that is saying. And then lastly, we could assess the feasibility and acceptance of the teach back for practitioners in real world settings to see if they think they could actually implement this in the clinic. So I would like to thank my thesis chair, Dr. Bayles, for helping me, and my main data collector, Donna, there in the back, for helping me too. Are there any questions?
Good job. Before questions, we have to take 2 minutes and explain this back to her, what you just told her. Yeah, do we have a question first?
I do have a question. Can you give us an example of what one of the instructions was, or something along those lines?
Yes, so are you talking about the written instructions? Yes, so I followed a well-known study in the field. It was back in the 1980s, so it has a very well-written instructions, and we used his exact instructions for my participants. So for each condition, it was like a 2-page instruction set that just told them how to respond to my different behaviors, if that makes sense.
Yes, okay, thank you. Yes.
Donna, could you explain in just a little bit more detail what the graphs are showing?
Yes, so on the right-hand, or on the left-hand side, on this side of the line, this is my baseline. So this is when they were responding to only written instructions. So this was before the teach back was implemented. So that's why it is not hitting 100% for some of these people. Especially over here, you can see that it's not hitting 100%. And then after the line is the phase change line. So then on the right side is the teach back. This is after that had been implemented. So we're seeing higher levels of responding on the right side of the phase change line because they have been taught through the teach back method.
So the scatter plots themselves, so each participant went through like a maximum of 12 sessions?
Yes, yes. So this
So
is,
only did like 6 sessions?
yes, exactly. So it's a multiple baseline design, which is a type of single subject research design. And so different people had to go through different things to show that I had experimental control over my study. So that's why you see some people had less sessions and some people had more. It has to show that I have experimental control. So that's why we did it that way.
Okay, thanks.
Okay, let's thank our speaker.